Hello friends, warm welcome to all. Our third lecture on the topic nutrition and health is related with malnutrition disorders, and in that we'll discuss topic anemia. The malnutrition related disorders includes anemia, that is B12 and iron deficiency anemia, then rickets, marasmus, goiter and kwashiorkor. With respect to following points, that is causes, symptoms and precautions and remedy on that. In today's lecture, we'll consider the first malnutrition related disorder, which is nothing but anemia. Anemia is a medical condition in which RBC count or hemoglobin is less than normal. Once again, anemia is a medical condition in which RBC means red blood cell count or hemoglobin is less than normal count. The normal level of hemoglobin is different in males and females. For men, anemia is typically defined as hemoglobin level of less than 13.5 gram percent, and in case of females as hemoglobin level of less than 12 gram percent. That means in case of males 13.5 gram percent, and in case of females hemoglobin level less than 12 gram percent. The three main causes of anemia are: first one, that is anemia caused due to blood loss. Second one, low RBC, that is red blood cell production. Third reason or cause, high rates of red blood cell destruction. For some people, the condition is caused by more than one of these reasons which are responsible for the RBC destruction. The blood loss is the most common cause of anemia. The blood loss, it may be of a short term or persisting over a period of time, that is for long term. Heavy menstrual bleeding or for a longer period due to menstrual related disorders or internal bleeding, that is which occurs in the digestive tract or urinary tract, can lead to blood loss. That means heavy menstruation or the bleeding for a longer period due to menstrual related disorders or internal bleeding in digestive or urinary tract can cause blood loss. The next reason, that is due to blood loss due to surgery, trauma or cancer, can also cause greater blood loss here. We'll consider the next one, that is low red blood cell production. Low rate of RBC production, that is second reason. Both acquired and inherited conditions and factors can prevent the body from making enough RBCs. Here, acquired means not born with the condition. Means these conditions are not exist at the time of birth, but this condition develop later on. Therefore, acquired means not born with the condition but develop it later. The second term, that is inherited condition, means parent pass the gene for this condition to their children. That is from one generation to the next generation. Acquired condition and factors that can lead to anemia include poor diet, means dietary conditions if they are not proper. Then abnormal hormone levels. Some chronic diseases and pregnancy may be the cause for here low rate of RBC production. High rates of RBC destruction, both acquired and inherited conditions and factors can cause destruction of too many red blood cells. One of the examples of the acquired condition is an enlarged or diseased spleen. That is, enlargement, swollen part of the spleen is shown. The spleen is an organ that removes worn out RBCs from the body. That is clearing of the RBCs. If the spleen is enlarged or in disease condition, it may remove more RBCs than normal rate. And as more RBCs are removed by the spleen, it ultimately leads to anemia. Now we'll consider the next point, that is symptoms of the anemia. The most common symptom of anemia is fatigue. That is feeling energyless or feeling tired or weak. People suffering from anemia may not have enough energy to do their normal activities. Other signs and symptoms of anemia include shortness of breath, that is shallow breathing, then dizziness, headache, coldness in hands and feet, that is in palms and feet. Then skin becomes paler in color. These signs and symptoms may occur because the heart has to work harder to pump oxygen-rich blood throughout the body. As the concentration of hemoglobin is low, heart has to work harder. Mild to moderate anemia may cause very mild symptoms or not at all. Now we'll consider the symptoms, or these symptoms are shown in diagram here. We can compare how the normal person is in one part, and in one half part of the body it shows the anemic person, so that we can compare it. Here the paler color of the skin is observed on anemic side, whereas the second symptom is headache, then feeling unusually weak or tired, then brittle nails becomes brittle, chest with pain with activity. When person does activities, the chest paining is observed. Then hands with brittle nails and cold hands and feet. Difficulty in getting enough air, therefore shallow breathing. These are the symptoms of the signs and symptoms of anemia. Now the next point is prevention, because prevention is better than cure. Although certain types of anemia cannot be prevented, but some type of anemia such as iron deficiency anemia and vitamin deficiency anemia can be prevented by choosing a proper diet that includes a variety of vitamins and nutrients, and these nutrients includes 1. Iron. Iron-rich food like red meat, beans, lentils, iron fortified cereals, dark green leafy vegetables, then dates or dry foods can increase iron content of our diet. Folic acid, that is second factor. Citrus fruits like lemon, orange, then bananas, dark green leafy vegetables, legumes, fortified breads and cereals, which are the rich sources for the folic acid. Then vitamin B12, which is present in meat, milk and dairy products. It is also observed in some cereals. Next is the vitamin C, which is present in the citrus fruits, melons, that like watermelon, and berries, which help to increase the iron absorption in the intestine and thus preventing the anemia. These are again the pictures of the RBCs in the normal condition, and the previous RBC is of anemic person, showing less number of hemoglobin in the RBC. Particles of hemoglobin, they are less or fewer compared with the normal normal RBC, which is observed in this slide. Now the next point, that is remedy of the anemia. Means after prevention, if the person becomes anemic, then how it can be treated. Anemia treatment depends on the cause of suffering. Means so as to minimize the effect of the particular cause, we can use the particular remedy. First one, that is iron deficiency anemia. This form of anemia is treated with bringing in change in the dietary condition and iron supplements. Then second one, vitamin deficiency anemia can be treated with folic acid, and vitamin C deficiency anemia are treated with dietary supplements and increasing these nutrients in the diet of the patient. Deficiency of vitamin B12 leads to pernicious anemia, which is caused by the lack of intrinsic factors in the stomach, that is inside the stomach, with consequent failure in absorption of vitamin B12 in the intestine of the human being. Such patients are treated with vitamin B12 injections. Third one, that is anemia due to chronic diseases. There is no specific treatment for this type of anemia. If symptoms become severe, the possible treatment is blood transfusion or injection of synthetic erythropoietin, which is a hormone normally produced by our kidneys, may help in stimulating RBC production of the body and is fatigue condition. Then fourth one is the aplastic anemia. This anemia is caused due to diseased bone marrow cells, which does not produce adequate number of matured RBCs. Here, the diseases occur due to diseased bone marrow, that is defective bone marrow, which does not produce adequate number of mature RBCs. As it is disease, unable to produce the sufficient number of matured RBCs. And next one, that is treatment for this anemia may include simple medications, chemotherapy, or blood transfusion to boost the level of RBCs. Sometimes bone marrow transplant is also needed, which is the treatment for aplastic anemia, because these cells are responsible for the production of the RBC. Therefore, the bone marrow is transplant. Then fifth one, that is hemolytic anemia. Lysis means breakdown of the hemoglobin. Drugs that suppress immune system of the body destroy RBCs. When such drugs are used at the condition of the organ transplantation or during organ transplantation or under autoimmune disorders such as RA, rheumatoid arthritis, that may lead to suppress the immune system of body and results in the destruction of the RBCs. Depending on the severity of the anemia, a blood transfusion or plasmapheresis may be necessary. Plasmapheresis means it is a type of blood filtering procedure, and the components are separated here. Treatment for the sickle cell anemia may include administration of oxygen, pain relieving drugs, and oral and intravenous fluids to reduce pain and prevent complication conditions. Sometimes blood transfusion, folic acid supplements, and antibiotics are advised to the patient. A bone marrow transplant may be effective treatment in some circumstances. Cancer drugs are used to treat sickle cell anemia. Thalassemia may be treated with blood transfusion. Folic acid supplements, removal of the spleen, that is splenectomy, and bone marrow transplant, etc. That means the conditions by which the patient is treated it depends upon the causes of the anemia. Thank you for watching my lecture. Share this video for the benefit of the maximum number of students, and do not forget to subscribe the channel World of Zoology for my notification of my next lecture. Thank you once again.